Hi everybody, this is Joanne Tolman. This is my focused assessment on pulmonary. And I have my patient with me and I have a student with me. And so I am going to be explaining a focused assessment for pulmonary for my student. My scenario is a home health visit. And this is a patient who called complaining of shortness of breath. And so I've been asked to come out as the nurse to do an assessment on her. So, hi.
Hi.
I'm going to start with some questioning, students. So what I'm going to do is do some subjective questioning with my patient so I can get an idea of her complaints and her symptoms. Hi.
Hi.
How are you?
I'm good. How are you?
Good. It's nice to meet you. I haven't taken care of you before. I'm Joanne.
I'm Jessica.
I'm a nurse. And I understand you're having some shortness of breath.
It started this morning after I got out of bed.
And you're on home health care because of your knee, right?
Yeah, but I just had my knee replaced and still working on getting that healed up, but we're doing good with that.
Good
so
job. Good. You're so young to have your knee replaced.
I know.
Oh man. Okay. Well, tell me about your shortness of breath. It started today?
Right after I got out of bed, I got up to use the bathroom.
Okay.
And I just noticed it was kind of harder for me to breathe. I was having to work a little harder to feel like I got enough air.
Okay. Is it feeling that way now?
No, I'm okay right now. It seemed to only happen after I would stand up and move around or do stuff rather than just sitting.
Do you have a history of asthma?
Mm-mm.
Okay, so I do ask my patients about their history. The next thing I want to find out about her is if she's having any chest pain. So Jessica, are you having any pain?
Nope.
When you take a deep breath?
Nope, it doesn't hurt.
It doesn't hurt. Okay, so your pain rating from 0 to 10 would be?
0.
0 pain. Okay.
Besides my knee.
Okay, and so what I heard you saying is your shortness of breath is worse when you're getting up and moving around? Okay, now tell me about your activity level in the last few days.
So I usually just get up and I try to move as much as I can handle with my knee, usually just getting up and using the bathroom or making breakfast or moving to my living room or things like that.
Okay, so you're getting around in the house. What about outside? Are you doing anything out on the driveway, on the sidewalk?
Nope, I haven't gone outside. I just kind of staying
In
inside.
the last few days since when you've been up in the home, tell me if you've had shortness of breath in the last few days. Just the activity that you do in the home.
Nope, I just started this morning.
Okay, all right. Well, I checked your immunization history. It looks like you've had your pneumonia vaccine and a flu shot.
Yes, I have.
So those things are good. What about environment? Tell me about allergies or anything that's changed. Has there been fires, smoke, anything that you think could have brought this on?
No, I mean, like I said, I haven't really been outside. I do have seasonal allergies like to pollen and like hay fever, but I haven't been outside in the last week since I've had this done.
Okay.
So I've mostly just been inside.
Well, if it's okay with you, Jessica, I'm going to move over to actually listening to your lungs, okay? I'm going to pause right here. So student, the whole time I was checking her questioning, I was watching her chest, I was watching her color, and I was watching how she positioned herself to take a breath. And I was also making a note is if she could finish a whole sentence without stopping to pause for a breath. And what I noticed in her is that she was carrying on a sentence pretty well. Her color looks good, and she's pretty much in a relaxed position, sitting upright, but not terribly forward or trying to posture to get a deep breath. So those are the things I look for when I do subjective questioning. Okay, because I need to teach Caleb how to do this, I'm going to have you sit forward just a little bit.
Okay.
All right, does that feel okay? All right. Okay, Caleb, so when I do a pulmonary assessment, I start in the back of my patient. And so first I'm going to inspect, and I would just kind of gently open her back. If she had on a robe, I would open it back, and I would try to do it on bare skin. So that's the first thing you want to do. And right now I am looking at, I take this opportunity to look at her spine, and it looks like it's in good alignment there. Color looks good. Her trunk looks normal. So what I'm looking for there is any barrel chest or any asymmetry of how she's lined up when she's sitting upright. Okay, Jessica, I'm going to start touching your back. Okay, this is called percussion. I'm going to do percussion and palpation. I don't need my stethoscope for that. First, I'm going to touch Jessica, and I'm going to say, does that feel any tenderness or pain?
No.
Okay. And I'm palpating up and down. And at this point, I'm going to put my hands right here, and I'm going to measure for her chest excursion when she takes a deep breath. Do one more for me, Jessica. And then what I notice there is that it's symmetrical. So when she takes a deep breath in, her lungs are expanding equally and symmetrically. All right, next thing I'm going to do is percussion. And at this point with my hand, I can't do percussion well, but I'm going to explain it. You have to have a really loose wrist, and you want to percuss on this distal phalange. You would lay all 3 fingers down on the patient and simply percuss right here. We're looking for resonance or dullness as we percuss. So resonance should be a nice, kind of a hollow, dull sound. And that would be over areas that have good aeration, I think is the best way to describe it. Dullness will happen over a spine, over the scapula, and I'll also be able to know where the liver is with my percussion. So there's 9 areas I'm going to simulate percussing. And I start right over here above the clavicle. And I'm listening as I percuss. Now I'm going to do 9 areas down her back. Jessica, will you just turn that way for me just a little bit? A little bit more. All right. So I've got 9 areas here that I'm going to do. Jessica's scapula is right here. So I'm going to target this area right in here for percussion. Then I'm going to go over here to about the 8th rib area. So I did this area here, and when we percuss, we go from side to side, checking all the way down, and we're comparing sides. And I can't percuss well. So, and we're going to get one more right over here. Okay, percussion sounds equal. To me, I didn't hear a lot of dense or dullness. So you would have some dullness again over areas that have consolidation. So if Jessica had pneumonia, I might pick up more dense percussion movements or dense tones. So that's generally what you're looking for, a difference between resonance and dullness or density. All right, I'm going to move on to auscultation onto Jessica's back. So still on the posterior side of my patient. And when I auscultate, you're going to use the diaphragm of your stethoscope, and you're going to be listening in the same areas where you percuss. And what I like my patient to do is do open mouth breathing. So Jessica, I'm going to have you take breaths in through your mouth and out. And you're going to feel like you're breathing a lot, so you need to let me know if you get dizzy during this, and I'll stop.
Okay.
Okay. So open mouth breathing. Okay, so I'm going to start right up here at the top. So breath in and out. Good. Another one in and out. Another one. In and out. Down. Another one. You'll notice I stay away from the scapula on both sides. One more. Okay, and again. Now I want to come a little bit more over to get this 8th rib area. This side. And then one more spot down here. And right here. Did you do okay through that? Okay. Okay, so on her auscultation, what I'm looking for are crackles or wheezes. Those are adventitious sounds. Up in the top, you're going to hear for more bronchial breath sounds. Through this area, it's going to be more bronchial vesicular. And then over in the lung field itself, right through here, it's going to be more vesicular sounds. So actually in Jessica, it sounded clear, both sides. Okay, Jessica, thank you.
You're welcome.
But I have to move on to the front.
Okay.
Okay, so I kind of do the same things that I do in the back, but I move to the anterior part of the chest. So I do like to get down on my patient's level, and if you can scoot over just a little bit in the front, thanks. I'm going to check again for your chest excursion. So I'm just going to place my hands here. I'm going to ask you to take a deep breath in. Good, and do one more for me. So that feels equal, okay? I feel good, equal movements. Her lungs are taking in air equally, both sides. Okay, let's move on to percussion next. Now, on anterior chest, not so many spots. We're down to about 5 spots. But I do the same technique, and I'm just going to simulate. Sorry. And I'm also checking for resonance and dullness. And that sounded equal. All right, let's see. I also want to move on to palpation. Any tenderness there?
Nope.
Okay. Also with palpation that I didn't mention before is sometimes you can sense crepitus, which is air that gathers underneath the subcutaneous tissue. And you can actually feel it feels like a little popping, and she doesn't have that. Another thing we can assess for is tactile fremitus. And that's something we can do in the back and in the front, but I'm going to demonstrate it in the front on Jessica. Jessica, I'm going to have you say the words 99 as I touch you.
Okay.
Because I should be able to hear, well, I'll hear you say 99, but I should be able to feel the vibrations from your voice onto your chest. They should feel equal to me. If they're diminished, that could be some consolidation again, okay? So I'm going to touch here. I can use the balls of my finger or the ulnar part of my hand. 99, ready?
99. 99.
Okay.
99. 99. 99. 99. 99. 99.
It's good. I wanted you to try just one more thing, just down here a little bit.
99. 99.
Good. I'm actually going to sneak back to her back, and I'm going to do the same thing quickly. Jessica, let's say 99 again.
99. 99. 99. 99. 99. 99.
And if you can feel
99.
that, I'll give you the opportunity to do that with me.
99.
Mm-hmm.
99.
Her sounds, the tactile fremitus sounds, the vibrations that I feel sound equal. So, and they sound like I would expect, or they feel like I would expect. Alrighty, so I'm going to listen to your chest now. So as we auscultate the chest, again, we're going to use the same areas. We're going to start above the clavicle area, and we're going to move down into the areas of the chest this way. Avoid the breast tissue on females, and ask them again to do open mouth breathing, and let me know if you get dizzy.
Okay.
Okay, so Jessica, breath in and out. It's good. just see if I can hear right under here. Deep breath in and out. One more. That's good. Let me hear this side. Good. So I thought when I heard Jessica this one part, I paused just a little bit because I thought I heard a little bit of a crackle. But as she did another breath for me, it cleared. And sometimes when you get atelectasis, which is an abnormal breath sound, if the patient coughs or does a deep breath, it will clear that or make it sound more improved or actually clear it completely. And in you, I didn't hear any adventitious sounds. Okay, so what does that mean for our focused assessment? Your lungs sound clear, Jessica. Why you're having the shortness of breath when you get up and move, I'm not sure, but while you're resting, I don't hear anything. That makes me want to call your physician right away. So, student, questions from you? Wrap it up later in class, but that would be a focused pulmonary assessment. Thank you, Jessica. Bye.